Hey everyone, it's Elango and welcome back to the channel. Today we're diving deep into a topic that's close to my heart, both literally and figuratively, cardiovascular diseases. We're going to break down the science behind these conditions, understand what's happening inside your body, and explore the steps you can take to live a longer, healthier life. We'll be covering everything from the most common types of cardiovascular diseases to their causes, symptoms, and most importantly, their treatments. It's going to be a comprehensive guide, so grab a glass of water, get comfortable, and let's get started. Let's start with one of the most prevalent cardiovascular diseases out there. Coronary artery disease, also known as CARD. Imagine your coronary arteries, the vital pathways that supply blood to your heart muscle, are like highways. Now picture those highways slowly narrowing due to a buildup of plaque, a sticky substance made up of fat, cholesterol and other materials. This buildup, my friends, is what we call atherosclerosis, and it's the hallmark of CAD. As plaque accumulates, it restricts blood flow to your heart, leading to symptoms like chest pain, especially during physical activity. This chest pain, known as angina, feels like a tight squeezing or pressure in your chest, and it's your body's way of telling you something is wrong. Now here's the thing about CAD. It can be a silent threat, meaning you might not experience any symptoms until the plaque buildup is significant. That's why it's crucial to understand your risk factors, which include high blood pressure, high cholesterol, smoking, diabetes, and family history of heart disease. The good news is that CAD is manageable, especially when detected early. Lifestyle changes like a healthy diet, regular exercise and quitting smoking can significantly reduce your risk. Additionally, medications can help lower cholesterol levels, control blood pressure and manage symptoms. Remember, knowledge is power, and understanding CAD is the first step towards a healthier heart. Let's talk about another silent threat to your heart health: hypertension, or as it's commonly known, high blood pressure. Think of your blood vessels as a network of pipes and your blood pressure as the force exerted against the walls of those pipes as your heart pumps blood. When this pressure consistently remains elevated, it puts extra strain on your heart and blood vessels, increasing the risk of serious complications. What makes hypertension particularly dangerous is that it often doesn't show any symptoms, earning it the nickname the silent killer. That's why regular blood pressure checks are crucial, especially as you get older. Now, what causes hypertension? It's often a combination of factors, including genetics, lifestyle choices, and underlying medical conditions. Being overweight or obese, leading a sedentary lifestyle, consuming too much salt, smoking, and excessive alcohol consumption can all contribute to high blood pressure. The good news is that hypertension is manageable with lifestyle changes and medications. Adopting a heart-healthy diet, engaging in regular physical activity, maintaining a healthy weight, and quitting smoking can make a world of difference. In some cases, medications may be necessary to lower blood pressure and reduce the risk of complications. Remember, managing hypertension is a lifelong commitment to a healthier you. Now let's talk about a condition that affects millions worldwide: heart failure. Despite its name, heart failure doesn't mean your heart has stopped working altogether. Instead, it means your heart is not pumping blood as efficiently as it should. Imagine your heart is like a pump responsible for circulating blood throughout your body. In heart failure, this pump weakens or becomes stiff, making it harder for it to meet your body's demands. This can lead to symptoms like fatigue, shortness of breath, swelling in your legs, ankles and feet, and difficulty sleeping lying down. What causes heart failure? Well, it can be a result of other cardiovascular diseases we've discussed, like coronary artery disease, hypertension and heart attacks. Other factors include certain viral infections, excessive alcohol consumption, and problems with heart valves. Treating heart failure typically involves a combination of lifestyle changes and medications. Medications can help remove excess fluid, lower blood pressure, and improve heart function. Lifestyle modifications, such as reducing salt intake, limiting fluid intake, and engaging in regular physical activity as tolerated, are crucial for managing symptoms and improving quality of life. While heart failure is a serious condition, it's important to remember that it can often be managed effectively with the right treatment plan and lifestyle adjustments. Next up, let's talk about those moments when you feel like your heart is skipping a beat, literally. We're talking about arrhythmias, a group of conditions that affect the rhythm of your heart. Think of your heart as an orchestra, with each beat representing a perfectly timed note. Arrhythmias are like those moments when the orchestra loses its rhythm, playing too fast, too slow, or irregularly. Now, not all arrhythmias are created equal. Some are harmless and don't require treatment, while others can be serious and even life-threatening. Symptoms of arrhythmias can vary widely, from barely noticeable palpitations to dizziness, shortness of breath, and fainting. So what causes these heart rhythm disturbances? Well, they can stem from a variety of factors, including coronary artery disease, high blood pressure, heart valve disorders, thyroid problems, electrolyte imbalances, and even excessive caffeine intake. Treating arrhythmias depends on the type and severity of the condition. Medications can help regulate heart rhythm, while procedures like catheter ablation can destroy small areas of heart tissue that are causing the irregular heartbeats. In some cases, implantable devices like pacemakers or defibrillators may be necessary to keep the heart beating at a normal rhythm. If you're experiencing any unusual heart palpitations or other symptoms, it's always best to consult your doctor to rule out any serious underlying conditions. Let's delve into a group of conditions that affect the heart muscle itself, cardiomyopathies. Imagine your heart muscle is like the engine of your circulatory system, responsible for pumping blood to every part of your body. In cardiomyopathies, this engine weakens, thickens, or becomes stiff, making it harder for the heart to do its job effectively. There are different types of cardiomyopathies, each with its own set of challenges. Dilated cardiomyopathy, the most common type, causes the heart chambers to enlarge, making it harder for the heart to pump blood. Hypertrophic cardiomyopathy, on the other hand, causes the heart muscle to thicken, particularly in the septum, the wall separating the heart's two lower chambers. Restrictive cardiomyopathy, the least common type, causes the heart muscle to become stiff and less elastic, making it difficult for the heart to fill with blood. Symptoms of cardiomyopathies can vary depending on the type and severity, but often include fatigue, shortness of breath, swelling in the legs, ankles and feet, and an irregular heartbeat. Treating cardiomyopathies focuses on managing symptoms and slowing disease progression. Medications can help regulate heart rhythm, lower blood pressure, and remove excess fluid from the body. In some cases, surgical interventions like heart valve repair or replacement, or even a heart transplant, may be necessary. While cardiomyopathies can be serious, early detection and treatment can significantly improve quality of life and long-term outcomes. Now let's shift our focus from the heart itself to the arteries that supply blood to your limbs, particularly your legs. We're talking about peripheral artery disease, or PAD. Remember that pesky plaque buildup we talked about in coronary artery disease? Well, it can also occur in the arteries of your legs and feet, narrowing them and reducing blood flow. This reduced blood flow can lead to symptoms like leg pain, especially during physical activity, numbness or weakness in the legs and feet, and even sores that heal poorly. What makes PAD particularly concerning is that it's often a sign of a more widespread atherosclerosis, meaning plaque may also be building up in other arteries, including those supplying blood to your heart and brain. Risk factors for PAD are similar to those of other cardiovascular diseases, including smoking, diabetes, high blood pressure, high cholesterol, and a family history of atherosclerosis. Treating PAD typically involves a combination of lifestyle changes and medications. Quitting smoking, managing diabetes, controlling blood pressure and cholesterol levels, and engaging in regular physical activity can significantly improve symptoms and slow disease progression. Medications can help improve blood flow, lower cholesterol levels, and prevent blood clots. In some cases, procedures like angioplasty or surgery may be necessary to open blocked arteries. Remember, PAD is a serious condition, but early detection and treatment can make a world of difference in preserving your mobility and overall health. Let's talk about a condition that can be a ticking time bomb if left undetected: aortic aneurysms. Imagine your aorta, the largest artery in your body, is like a garden hose responsible for carrying oxygen-rich blood from your heart to the rest of your body. An aneurysm is a bulge or weak spot in the wall of this hose, and as the pressure inside builds, it can cause the aneurysm to grow larger and potentially rupture. Aortic aneurysms often develop slowly over time and don't cause symptoms until they become large or rupture. When symptoms do occur, they can include a pulsating sensation near the navel, pain in the back, chest, or abdomen, and shortness of breath. The most common type of aortic aneurysm is an abdominal aortic aneurysm, which occurs in the part of the aorta that runs through your abdomen. Thoracic aortic aneurysms, on the other hand, occur in the part of the aorta that runs through your chest. Risk factors for aortic aneurysms include smoking, high blood pressure, high cholesterol, family history of aneurysms, and certain genetic conditions. Treatment for aortic aneurysms depends on the size, location, and likelihood of rupture. Small, slow-growing aneurysms may be monitored with regular imaging tests. Larger aneurysms, or those at risk of rupture, usually require surgery to repair or replace the weakened section of the aorta. If you have any risk factors for aortic aneurysms, it's crucial to talk to your doctor about screening and early detection. Finally, let's talk about the gatekeepers of your heart valves. These 4 valves act like one-way doors, ensuring blood flows in the right direction through your heart. Valvular heart diseases occur when these valves don't open or close properly, disrupting blood flow and forcing your heart to work harder. There are different types of valvular heart diseases, each affecting the valves in unique ways. Valve stenosis occurs when the valve opening narrows, restricting blood flow. Valve regurgitation, on the other hand, occurs when the valve doesn't close properly, allowing blood to leak backward. These conditions can affect any of the 4 heart valves: the mitral, aortic, tricuspid, and pulmonary valves. Symptoms of valvular heart diseases can vary widely depending on the type and severity, but often include fatigue, shortness of breath, chest pain, heart palpitations, and swelling in the legs, ankles, and feet. Treating valvular heart diseases depends on the type, severity, and cause. Medications can help manage symptoms, regulate heart rhythm, and prevent blood clots. However, in many cases, valve repair or replacement surgery is necessary to restore proper blood flow. If you're experiencing any symptoms of valvular heart disease, it's essential to consult your doctor for proper diagnosis and treatment. That was a lot of information, but remember, knowledge is power when it comes to your health. Understanding these cardiovascular diseases is crucial for prevention and management. Stay informed, make healthy lifestyle choices, and consult your healthcare provider for regular checkups. Remember those risk factors we talked about? Many of them are within your control. Eat a balanced diet, get moving, quit smoking. These simple changes can make a world of difference. Thanks for watching, and take care of your heart.